Hey, I am Dr. Sreejith. I am Secretary to IMA Trivandrum. I would like to thank Mr. Krishna Kumar, President PMI, to give an opportunity or giving me an invitation to talk on a video related to the awareness regarding coronavirus. As you all know, in December 2019, a cluster of pneumonia cases have been reported from Wuhan province in China, and later on it has been found or being named as novel coronavirus 2019. Coronavirus is a large group of virus which is having a genetic code with some protein spikes around it, giving a crown-like appearance. So you might have seen the photographs of coronavirus being circulated in all the social medias and medias. No, it's a pandemic all over with some mortality, and which affects more of elderly of more than 65 years, having some morbidity or impending some diseases like diabetes, something having some heart disease, some neurological disorder. So people above 65 years having some morbidity is the worst affected people. Now, this transmission of this virus is majorly from the animals, say wild animals. And as you know, previously, as I said before, the SARS, that is severe acute respiratory syndrome virus, which has been found from China itself in 2003, it is from a civet cat. And MERS, that is Middle East respiratory syndrome, which is from Saudi Arabia, has been from an camel. Here in COVID-19, we are not sure till now regarding from which animal transmission it has come from. We are thinking it is from the wild bat or something. So it's still on the progress of finding the source of this particular virus. Now, how it has been spread from the animals to man? Usually there is something called, when there is an increased contact with animal, the virus from the animal will get spilled or spillage occurs to man. It is usually due to the mutation or due to some increased contact with the animal. This particular phenomenon happens. And as you know, from man, the sick infected man, it will go to the family members, and then it will go to the health workers, and it's a vice versa thing, and it will spread the whole world. Now, how can we take the precautionary measures, or how can we diagnose, or what are the symptoms of this particular illness? As you know, it's a virus, it's a respiratory virus, so it can be from a mild cold to cough with shortness of breath, and in the severe cases it may lead to pneumonia and as well as kidney failure. That's how the thing progresses. As I said before, those who are having impending disease or more than 65 years may go for severe pneumonia and severe organ dysfunction. It doesn't mean that people who are not old, who are young, may not get infected. They are equally vulnerable, but above 65 years of age are the groups who is having more morbidity and mortality till now. Regarding diagnosis, we have the most accepted one is PCR test, that is polymerase chain reaction test. The swabs will be taken from the nasal as well as from the throat, and the blood sample also will be taken and PCR test is being done. That is having the most 100% sensitivity and specificity for the diagnosis of this novel coronavirus. The another thing which has been found effective in finding whether community spread is there is rapid serological test, which has been done in many countries to find out whether there is a community spread or not. But it doesn't give you the 100% specificity and sensitivity as PCR test. Now coming to treatment. What are the treatment options available for this coronavirus 19? It's all supportive treatment which is available, and there is no vaccines being effective till now. It's under the way or under preparation. The main aspect in controlling of coronavirus or novel COVID-19 is by the preventive strategy which we do. The main thing is break the chain concept. Break the chain is to break the spread of the disease from within human being, that is from infected to the other non-infected person or from infected to healthcare and vice versa. How to do that? As I said, this is a droplet spread infection. So what happens in droplet spread infection is the droplet which has been spilled out from an infected person will be carried to a non-infected person when he or she comes in contact with this droplet or with the instrument or some surfaces where the droplet is being spilled. So the effective way of controlling the spillover is by using medical mask or using the flexed elbow while coughing or using some tissues. So we can control the droplet infection by doing these kind of simple methods. Next is the hand hygiene aspect. By washing your hands with soap and water, or if not available with a sanitizer, for 20 seconds will make your hand disinfected so that the droplets won't get infected or will be there on the surface of your hands so that it will affect you or infect you. So the two aspect which is important is break the chain. In the two aspect is one, use of proper mask or personal protection equipments, and second is hand hygiene, which is very important. So with these two methods we can prevent the spread. The another aspect is social distancing. So what do you mean by social distancing? So as you know, the spread of this coronavirus is very rapid. If you distance ourselves, be at our home premises, quarantine ourselves for a period of this incubation period time, that there is very less chance of being infected or the community spread can be limited with this social spread or social distancing, So let me conclude by telling you or informing you, the coronavirus, the treatment option available is supportive. So the main options, the main thing in the treatment of coronavirus is prevention. That is by break the chain method. That is by either using a medical mask or personal protection equipment, or by using proper hand hygiene, and the main aspect is social distancing.